Asthma, one of the most common chronic respiratory diseases, affects over 300 million people worldwide, disrupting daily life and, in severe cases, becoming life-threatening. But what really causes asthma? How can we recognize its symptoms early? And most importantly, how can it be effectively managed, especially in a country like India, where environmental and lifestyle factors play a major role? In this video, we'll break down everything you need to know about asthma, from its causes and symptoms to diagnosis, treatment, and real-world management strategies. Whether you're a patient, caregiver, or medical professional, this guide will help you understand how to take control of asthma and improve quality of life. Imagine waking up in the middle of the night, struggling to catch your breath. That's the reality for many with asthma, a chronic condition where airways become inflamed, narrow, and fill with mucus. But here's the good news. Understanding asthma is the first step toward managing it. It starts with genetics. Some of us are simply more prone to it. Add environmental triggers like pollen, pollution, or even stress, and symptoms flare up: wheezing, breathlessness, chest tightness, and that nagging cough that worsens at night. Diagnosis: a mix of listening to the patient's story and tests like spirometry. Treatment: inhaled corticosteroids to calm inflammation and bronchodilators for quick relief. And remember, severe attacks demand immediate action. Bluish lips or struggling to speak? Don't wait. Seek help. Let's tackle the questions that keep many awake at night. Is asthma curable? Not yet, but with the right care, it's controllable. Will my child outgrow it? Sometimes, but often it lingers into adulthood. Are inhalers addictive? Absolutely not. They're lifelines, not crutches. Can I still exercise? Yes. With the right plan, you can run, swim, and thrive. What saves me during an attack? Your reliever inhaler, calm breaths, and help if it worsens. Knowledge dispels fear. Let's replace uncertainty with confidence. Recognizing asthma symptoms. The clinical presentation of asthma varies significantly between individuals. Some experience intermittent wheezing triggered by specific exposures, while others have persistent nighttime coughing. The sensation of chest tightness is often described as feeling like a heavy weight on the chest. Understanding these patterns helps guide appropriate treatment approaches. Asthma prevalence. Worldwide, current epidemiological data shows asthma affects approximately 5 to 10% of populations in most countries, with higher prevalence in industrialized nations. About 1,000 people per day die from asthma. In India, studies indicate between 2 to 7% of adults live with asthma, though underdiagnosis remains a significant challenge, particularly in rural areas. The Indian asthma landscape. Our country faces unique challenges in asthma management, including high levels of urban air pollution, limited access to spirometry in primary care settings, and cultural misconceptions about inhaler use. However, initiatives like affordable generic medications and community health worker training programs are helping bridge these gaps. Economic consequences of asthma. The financial burden extends beyond direct medical costs to include lost productivity from missed workdays and reduced efficiency when symptoms aren't well controlled. For families, the cumulative costs of medications and hospitalizations can create significant financial strain, particularly for those without health insurance coverage. How asthma develops over time. The natural history of asthma involves multiple stages, beginning with genetic susceptibility that may be present from birth. Environmental exposures then activate these predispositions, leading to airway inflammation and remodeling. Eventually, this manifests as the characteristic symptoms we recognize as clinical asthma. The genetic basis of asthma. Family and twin studies clearly demonstrate the hereditary component of asthma, with heritability estimates ranging from 35 to 70%. Specific genes involved in immune regulation, such as those controlling interleukin production and IgE responses, have been consistently associated with asthma development across populations. Underlying disease mechanisms. The pathophysiology of asthma involves a complex interplay of inflammatory cells, airway structural changes, and physiological responses. Key components include eosinophilic infiltration of airway walls, hypertrophy of bronchial smooth muscle, and hyperplasia of mucus-producing goblet cells, all contributing to airflow limitation. Inflammatory subtypes in asthma. We now recognize distinct inflammatory patterns in asthma. Type 2 inflammation, driven by cytokines like IL-4, Illinois-5, and IL-13, is typically associated with allergic triggers and eosinophilic infiltration. Non-type 2 inflammation may involve different pathways and often proves more resistant to standard corticosteroid treatment. The allergic inflammation cascade. In allergic asthma, exposure to triggers initiates a well-defined immunological sequence. Dendritic cells process allergens and present them to T cells, which differentiate into Th2 cells, producing characteristic cytokines. These in turn stimulate IgE production by B cells and recruit eosinophils to the airways, sustaining the inflammatory response. Key inflammatory mediators. Multiple molecular players contribute to asthma pathogenesis, including leukotrienes that induce bronchoconstriction, histamine that increases vascular permeability, and various chemokines that recruit inflammatory cells. Understanding these mediators has enabled development of targeted therapies like leukotriene receptor antagonists. Modifiable and non-modifiable risk factors. While we can't change genetic risk factors, many environmental contributors to asthma development are potentially modifiable. These include reducing exposure to tobacco smoke, improving indoor air quality, and preventing severe respiratory infections in early childhood through vaccination and hygiene measures. Occupational asthma. Risks. Certain occupations carry significantly increased asthma risk due to exposure to sensitizing agents. Healthcare workers may develop latex allergy, bakers can become sensitized to flour proteins, and painters may react to isocyanate compounds. Early identification and exposure reduction are crucial to preventing permanent airway damage. Common asthma triggers. Asthma exacerbations can be triggered by diverse factors, including viral respiratory infections, outdoor air pollution spikes, weather changes, and exposure to specific allergens. Individual trigger profiles vary significantly, making personalized trigger identification an important component of comprehensive asthma management. Frequently associated conditions. Asthma rarely occurs in isolation. Many patients also experience allergic rhinitis, gastroesophageal reflux, or obstructive sleep apnea. These comorbidities can significantly impact asthma control and quality of life, necessitating a holistic treatment approach that addresses all coexisting conditions. The diagnostic process. Accurate asthma diagnosis requires careful integration of clinical history with objective testing. Characteristic symptom patterns combined with demonstration of variable airflow limitation through spirometry or peak flow monitoring form the diagnostic foundation. Challenge testing may be needed in uncertain cases. Pulmonary function testing essentials. Spirometry provides crucial quantitative data, including FEV1 or forced expiratory volume in 1 second, FVC or forced vital capacity, and their ratio. Bronchodilator response testing showing significant improvement in these parameters after medication administration supports an asthma diagnosis. Bronchial challenge testing. Diagnosing asthma can sometimes be complex, particularly when standard spirometry results appear normal despite the presence of respiratory symptoms. In such cases, bronchial provocation testing serves as an essential diagnostic tool. This controlled test evaluates airway responsiveness by exposing the patient to substances like methacholine, mannitol, or exercise, which can induce airway narrowing in individuals with asthma. A positive test result confirms bronchial hyperreactivity, a hallmark of asthma, and helps establish a definitive diagnosis. This testing is particularly useful in patients with mild or intermittent symptoms, where routine lung function assessments may not reveal any abnormalities. By identifying airway sensitivity early, clinicians can ensure timely intervention and appropriate treatment. Biomarkers in clinical practice. The management of asthma has significantly evolved with the integration of biomarkers, offering a more personalized approach to treatment. Biomarkers such as blood eosinophil counts, fractional exhaled nitric oxide or FeNO, and allergen-specific IgE levels provide critical insight into the underlying inflammatory processes driving the disease. Elevated eosinophil counts indicate type 2 inflammation and help in determining the need for biologic therapies, while FeNO levels serve as a marker of airway inflammation and corticosteroid responsiveness. Additionally, allergen-specific IgE measurements assist in identifying potential triggers, allowing for targeted environmental modifications and immunotherapy when appropriate. By utilizing these biomarkers, clinicians can refine treatment strategies, improve disease monitoring, and enhance overall asthma control, particularly in patients with severe or treatment-resistant cases. Conditions that mimic asthma. While asthma is a common cause of respiratory symptoms, it is not the only condition that presents with wheezing, coughing, and breathlessness. Several other diseases can mimic asthma, making accurate diagnosis critical for effective management. Vocal cord dysfunction, for instance, leads to abnormal vocal cord movement, resulting in inspiratory stridor rather than the characteristic expiratory wheezing of asthma. Chronic obstructive pulmonary disease, or COPD, also shares symptoms with asthma, but is typically associated with long-term smoking history and irreversible airway obstruction. Another condition, bronchiectasis, involves permanent airway dilation, leading to persistent cough and mucus production, which can be mistaken for asthma-related inflammation. Additionally, certain cardiac conditions, such as congestive heart failure, can cause shortness of breath and wheezing, further complicating the diagnosis. Given these overlapping symptoms, a thorough clinical evaluation incorporating spirometry, imaging, and biomarker analysis is essential to distinguish asthma from these conditions and ensure that patients receive the most appropriate and effective treatment. Comprehensive treatment goals. Optimal asthma management aims beyond symptom control to include preserving normal lung function, maintaining quality of life, preventing exacerbations, and minimizing medication side effects. These goals require ongoing partnership between patients and healthcare providers. Environmental control strategies. Effective trigger reduction involves practical measures like using allergen-impermeable bedding, maintaining indoor humidity below 50%, and implementing thorough pest control. For outdoor triggers, monitoring air quality indices and adjusting activities accordingly can help minimize exposures. Bronchodilator. Medications. Bronchodilators play a critical role in asthma management by helping to open the airways and improve airflow. These medications come in different forms, each with specific uses. Short-acting beta agonists, or SABAs, like salbutamol or albuterol, provide rapid relief during an asthma attack. By relaxing the airway muscles within minutes, they help restore normal breathing and are essential rescue medications. However, frequent use indicates poor asthma control and the need for long-term management adjustments. Long-acting beta agonists, or LABAs, such as salmeterol, offer prolonged bronchodilation for up to 12 hours. These are never used alone. They must be combined with inhaled corticosteroids to ensure safe and effective control of persistent asthma symptoms. Anticholinergic bronchodilators like ipratropium provide an alternative for patients who do not tolerate beta agonists well. By blocking acetylcholine receptors, they prevent airway constriction and are especially useful for chronic symptoms or in combination with other bronchodilators for enhanced relief. Inhaled corticosteroid therapy. Inhaled corticosteroids, or ICS, are the gold standard for long-term asthma control. They work by reducing airway inflammation, thereby preventing symptoms and improving overall lung function. ICS come in different strengths and formulations, allowing for tailored therapy based on asthma, severity, and patient response. Using a spacer device improves medication absorption in the lungs while reducing side effects like oral thrush. Consistent ICS use lowers the risk of severe asthma attacks, hospitalizations, and reliance on oral corticosteroids. For patients with mild asthma, lower potency ICS may suffice, whereas severe cases require higher potency formulations to achieve adequate control. Alternative controller. Options. For some patients, inhaled therapies may not be suitable due to poor technique, intolerance, or personal preference. In such cases, oral controller medications offer effective alternatives. Leukotriene receptor antagonists like montelukast help reduce airway inflammation and are particularly beneficial for exercise-induced asthma and allergic triggers. Theophylline, though less commonly used today, remains a cost-effective option in resource-limited settings. However, it requires careful blood level monitoring due to its narrow therapeutic range and risk of side effects. Biologic therapies for severe asthma. For patients with severe, uncontrolled asthma, biologic therapies have revolutionized treatment. These targeted medications focus on specific inflammatory pathways and are administered via subcutaneous or intravenous injections. 5 major classes of biologics are currently available, each designed for specific asthma phenotypes, such as eosinophilic or allergic asthma. By blocking key immune mediators, biologics can reduce exacerbations, improve lung function, and minimize dependence on steroids. Delivering effective asthma care in India requires addressing unique challenges, including medication affordability, pollution exposure, and health literacy. Strategies like generic drug substitution, spacer device improvisation, and community health worker training help overcome these barriers. Managing acute exacerbations. Severe asthma attacks require prompt, aggressive treatment including oxygen supplementation, frequent bronchodilator administration, and systemic corticosteroids. Clear action plans help patients recognize early warning signs and initiate appropriate self-management while seeking medical care. Asthma in pregnancy. Maintaining good asthma control during pregnancy is essential for both maternal and fetal well-being. Most asthma medications are considered safe during pregnancy, and the risks of uncontrolled asthma generally outweigh potential medication concerns. Geriatric asthma. Considerations. Asthma in older adults presents unique challenges, including diagnostic confusion with COPD, increased medication side effect risks, and physical limitations affecting inhaler use. Simplified regimens and caregiver involvement often improve outcomes in this population. Exercise-induced symptoms. For many asthma patients, physical activity can trigger airway narrowing, leading to symptoms like coughing, wheezing, and shortness of breath. This is known as exercise-induced bronchoconstriction. The condition results from the cooling and drying of airways during vigorous activity, which can provoke inflammation and airway constriction. However, exercise is crucial for overall health and should not be avoided. Preventive strategies include proper warm-ups before activity, using bronchodilators such as short-acting beta agonists before exercise, and in some cases, daily controller medications to reduce underlying airway sensitivity. With the right approach, individuals with asthma can stay active and participate fully in physical activities without fear of exacerbations. Aspirin-exacerbated respiratory disease, or AERD. Aspirin-exacerbated respiratory disease, or AERD, is a distinct and challenging asthma subtype characterized by a triad of symptoms: asthma, chronic rhinosinusitis with nasal polyps, and respiratory reactions to nonsteroidal anti-inflammatory drugs, or NSAIDs, such as aspirin or ibuprofen. In affected individuals, exposure to cyclooxygenase 1 or COX-1 inhibitors triggers severe bronchospasm and nasal congestion, making strict avoidance crucial. Management strategies often include leukotriene-modifying drugs, nasal and inhaled corticosteroids, and in some cases, biologic therapies to control persistent inflammation. Early recognition and proper treatment can significantly improve symptom control and quality of life for those with AERD. Defining severe asthma. Severe asthma, though affecting only 5 to 10% of asthma patients, has a disproportionately high impact on healthcare utilization, with frequent exacerbations, hospitalizations, and an increased need for intensive treatment. A formal diagnosis of severe asthma is not just about persistent symptoms. It requires a thorough evaluation to confirm that symptoms persist despite optimized conventional therapy. This includes ensuring proper medication adherence, correct inhaler technique, and addressing modifiable risk factors before considering advanced treatment options like biologic therapies or targeted interventions. Identifying and managing severe asthma appropriately can significantly improve quality of life and reduce the burden of uncontrolled symptoms. Phenotyping severe asthma. Not all severe asthma is the same. Understanding its underlying inflammatory patterns is key to selecting the right treatment. Severe asthma can be categorized into different phenotypes, such as eosinophilic, neutrophilic, or posigranulocytic, each with distinct biological mechanisms and treatment responses. The emergence of precision medicine has revolutionized the management of severe asthma, allowing for targeted therapies that directly address specific inflammatory pathways. This individualized approach has transformed outcomes for many patients who previously had limited options and struggled with persistent symptoms despite standard therapies. Managing severe asthma. Optimal management of severe asthma involves a multifaceted approach. First, maximal conventional therapy is essential, which includes high-dose inhaled corticosteroids combined with long-acting bronchodilators. When conventional therapy is insufficient, phenotype-specific biologic treatments, such as monoclonal antibodies targeting specific immune pathways, as like anti-IL-5, anti-IgE, etc., may be considered to target the underlying causes of asthma inflammation. Additionally, addressing comorbidities like nasal polyps, gastroesophageal reflux disease, or obesity is crucial for improving overall asthma control. Given the complexity of severe asthma, specialist referral to a pulmonologist or asthma specialist is often necessary to tailor an individualized treatment plan and ensure optimal management. Asthma-COPD overlap syndrome is a condition that presents features of both asthma and COPD, such as chronic airflow limitation, wheezing, and shortness of breath. Diagnosis involves spirometry to assess both reversible and persistent airflow obstruction. Treatment typically includes inhaled corticosteroids for inflammation control, combined with long-acting bronchodilators for bronchodilation. Smoking cessation is essential for those with a smoking history to prevent further lung damage. Effective management requires a tailored approach, combining strategies for both asthma and COPD. Patient self-management. Education. Empowering patients with the right knowledge is crucial for effective asthma control. Educating individuals on proper inhaler technique ensures they receive the full benefit of their medication. Teaching them how to monitor symptoms and recognize early warning signs allows for timely intervention before an exacerbation occurs. Equally important is medication adherence. Helping patients understand why they need to take their controller medication daily, even when they feel fine, can prevent severe attacks. Personalized written asthma action plans provide clear guidance on managing symptoms and adjusting treatment as needed, leading to significantly improved outcomes. When patients feel confident in managing their condition, they are more likely to stay in control and avoid unnecessary emergency visits. Regular monitoring is essential to keep asthma well controlled. Relying solely on how a patient feels can sometimes be misleading, which is why objective measures like spirometry or peak flow monitoring are vital tools in asthma management. Symptom questionnaires can help track patterns and identify worsening conditions early. Patients should be encouraged to assess their asthma more frequently during treatment changes or if symptoms become unstable. By routinely evaluating lung function and symptoms, healthcare providers can make necessary adjustments to treatment, ensuring optimal asthma control and reducing the risk of complications. Pediatric asthma. Considerations. Childhood asthma differs from adult disease in its variable presentation, greater likelihood of viral-induced exacerbations, and unique challenges in medication delivery. Age-appropriate inhaler devices and regular growth monitoring are essential components of pediatric asthma care. Recommended vaccinations. Annual influenza vaccination and appropriate pneumococcal immunization are particularly important for asthma patients, as respiratory infections commonly trigger exacerbations. COVID-19 vaccination is also recommended based on current guidelines. Identifying high-risk patients. For some individuals, asthma is more than just an occasional inconvenience. It's a condition that can lead to life-threatening situations. Patients with a history of intensive care admissions, frequent emergency visits, or poor adherence to controller medications are at the highest risk of severe complications. By proactively identifying these individuals, healthcare providers can implement targeted interventions, such as personalized asthma action plans, better medication management, and increased patient education. These efforts can help prevent hospitalizations and improve overall quality of life. Complementary approaches. Many patients explore complementary therapies in their quest for better asthma control. Practices like breathing exercises, yoga, or acupuncture may offer some benefits, particularly in stress reduction and relaxation. However, these should never replace evidence-based treatments. Encouraging open conversations about complementary therapies allows for the safe integration of these practices while reinforcing the importance of inhalers and other prescribed medications as the cornerstone of asthma management. Mitigating pollution effects. Living in a polluted environment can be particularly challenging for asthma sufferers, as airborne pollutants can trigger or worsen symptoms. Practical strategies such as using N95 masks on high-pollution days, keeping windows closed during peak traffic hours, and investing in air purifiers can significantly reduce exposure. Additionally, structuring outdoor activities around times of lower pollution levels can help individuals better manage their condition and maintain an active lifestyle without unnecessary risk. Improving indoor air quality. For those with asthma, home should be a sanctuary, not a source of triggers. Transitioning from biomass fuels to cleaner cooking options, maintaining low indoor humidity to prevent mold growth, and avoiding strong chemical cleaners or air fresheners can significantly improve air quality. Simple measures like using hypoallergenic bedding, ensuring proper ventilation, and frequently dusting surfaces can further help in reducing irritants that can provoke asthma symptoms. Preventing occupational asthma. Asthma doesn't just affect people at home, it can also develop or worsen in the workplace. Occupational asthma is a serious concern in industries where workers are exposed to dust, fumes, or chemicals. Employers and employees alike must take proactive steps, including exposure control measures, proper ventilation, and the use of protective respiratory equipment. Educating workers about early warning signs empowers them to seek timely medical intervention, preventing long-term damage and improving workplace safety. Asthma and COVID-19. At the start of the COVID-19 pandemic, concerns were high that asthma might lead to worse outcomes. However, research has shown that well-controlled asthma does not significantly increase the risk of severe COVID-19. The key takeaway remains the importance of maintaining good asthma control, staying on prescribed medications, avoiding triggers, and ensuring timely vaccinations. Telehealth has also emerged as a valuable tool, allowing patients to receive care and guidance without unnecessary exposure to infections. Urban-rural differences. Where a person lives can greatly influence their asthma management. In urban settings, exposure to pollution, traffic emissions, and allergens is a major challenge, whereas rural patients may struggle with access to specialized healthcare providers. Addressing these disparities requires tailored approaches, such as improved healthcare infrastructure in rural areas and pollution control measures in cities. By recognizing these distinct challenges, better policies and healthcare solutions can be implemented to support all asthma patients, regardless of their location. Unified airway management. The respiratory system functions as a whole, and conditions affecting one part can impact another. For example, allergic rhinitis and sinusitis can worsen asthma symptoms if left untreated. A unified approach to airway management, treating both upper and lower airway conditions, can significantly enhance asthma control. This highlights the need for a comprehensive treatment strategy that considers all aspects of respiratory health rather than addressing symptoms in isolation. Allergic bronchopulmonary aspergillosis, or ABPA. ABPA is a serious complication caused by an exaggerated immune response to the fungus Aspergillus. It primarily affects individuals with asthma or cystic fibrosis, leading to airway inflammation and potential lung damage. Early diagnosis is crucial and involves specific IgE testing, imaging studies, and sometimes sputum cultures to confirm fungal involvement. Treatment typically includes prolonged antifungal therapy to reduce fungal load and corticosteroids to control the immune response and prevent further lung deterioration. Without timely intervention, ABPA can lead to progressive bronchiectasis and long-term respiratory complications. Cost-effective asthma care. In resource-limited settings, providing effective asthma care can be challenging. Strategies such as using essential medicine formulary drugs, training non-physician healthcare workers in asthma management, and implementing group education sessions can help maximize limited resources. By prioritizing cost-effective interventions, healthcare systems can ensure that more patients receive necessary treatment without excessive financial burden. Despite advances in asthma care, misconceptions about the condition persist. Some people believe asthma is contagious, while others fear that inhalers are addictive or a sign of weakness. These stigmas can prevent individuals from seeking appropriate care or using their inhalers in public. Public education campaigns featuring trusted local figures and community engagement initiatives can help normalize asthma, encourage adherence to treatment, and reduce the psychological burden of stigma. Emerging research directions. The future of asthma care is being shaped by exciting research in several key areas. Scientists are exploring the role of the microbiome in asthma development, identifying genetic predictors of treatment response, leveraging digital health applications for remote monitoring, and investigating novel biologic therapies. These breakthroughs hold the promise of more precise, personalized, and effective asthma treatments in the years to come. Personalized action plans. Managing asthma effectively requires a clear and individualized approach. Personalized action plans outline daily controller medication use, provide criteria for recognizing worsening symptoms, and specify step-up measures when needed. These plans empower patients to take proactive steps in managing their asthma, reducing the risk of severe attacks and hospitalizations. Tailored to each patient's condition and medication regimen, action plans are a critical tool for long-term asthma control. Optimizing inhaler technique. Proper inhaler technique is essential for effective asthma management, yet many patients use their inhalers incorrectly, reducing medication efficacy. For metered dose inhalers or MDIs, shake the inhaler well. Exhale fully, then place the mouthpiece between your lips, forming a tight seal. As you press the canister, inhale slowly and deeply to allow the medication to reach your lungs. Hold your breath for about 10 seconds before exhaling gently. For dry powder inhalers or DPIs, load the dose as per the device instructions. Exhale away from the inhaler to avoid moisture affecting the powder. Place the mouthpiece in your mouth and inhale quickly and forcefully to draw the medication deep into your lungs. Hold your breath for a few seconds before exhaling. Regular reassessment with healthcare providers helps prevent common errors and ensures optimal medication delivery, leading to better asthma control. National Asthma Initiatives. India's National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke, or NPCDCS, now includes asthma components, helping integrate care into primary health services. Pregnancy management guidelines. Key principles include continuing controller medications, using budesonide as the preferred inhaled steroid due to its extensive safety data, and monitoring lung function monthly to maintain optimal control. Telehealth applications. Remote asthma management incorporating digital peak flow. Monitoring, video consultations, and mobile app-based action plans can expand access while maintaining quality, particularly for follow-up care. Building healthcare capacity. A tiered training approach. Specialists managing complex cases, general practitioners handling routine care, and community health workers supporting basic management creates a sustainable asthma care network. Key takeaways and future directions. Asthma management has advanced significantly, focusing on personalized treatment, trigger control, and patient empowerment. Future progress lies in addressing environmental factors, enhancing medication accessibility, and deepening our understanding of asthma's complexities. With ongoing research and collaboration, we move closer to improved control and, ultimately, a cure. Thank you for your time and dedication to enhancing asthma care and awareness.